As Minister for Health, I have the responsibility of renewing the pandemic orders, and what I wanted to do today is to outline to you the additions to the existing orders that will come into play from 11:59 p.m. tonight. So we have some updated settings in place, and I believe that these are sensible and balanced measures. I want to remind you all that as Health Minister, I'm not only required to take the advice of the Chief Health Officer in relation to making the pandemic orders, but under our legislative framework, I'm also obliged to consult with industry and community leaders and with my colleagues so that I can make a decision that's in the best interest, not just of the health and wellbeing of all Victorians, but of course to consider some of the social and economic impacts of the orders. So, from 11:59 p.m. tonight, the period when someone is considered a recently confirmed case and therefore exempt from testing and isolation requirements has been revised to 4 weeks, down from 12 weeks. Positive cases are still required to isolate for 7 days from the day they took their test, but an additional reason to leave home has been added. And that is to provide transport for a household member to obtain food if that is essential. The infected person will of course be required to remain in the car and to wear a face covering at all times. Mask wearing indoor and in crowded settings is strongly recommended, but there will not be any changes to the current face mask requirements with these new pandemic orders.
Would we have tougher rules if there wasn't an election this year?
As the Minister for Health has just outlined, she is required under the legislation to consider the health advice, but also to consult with community, industry, business leaders and take into account broader social and economic factors into making her decision. And this is all about having the right, sensible, common sense settings in place to protect and support the Victorian community. And it's also important to note that whilst every health system around the country is also facing similar pressures, the settings across the country are also consistent. The settings here in Victoria are consistent Australia-wide, and that's important, so that the community is receiving consistent messages about the steps that they can take, either as individuals around getting vaccinated, the strong recommendation now to wear masks indoors, and also to work with business and industry about continuing to provide support for the measures that are in place that we know will make a difference in helping to stop and slow the spread of this virus.
I'm just interested in a yes or no to that, because you can hear on the radio, excuse me, you can see in the newspapers, people think you don't have tougher rules because there is an election. Is that the reason?
Well, the reason is based on the advice that the Health Minister has taken from both health and broader industry and community leaders. She's required to do this under the pandemic legislation, and this is all about having measures in place that are also the COVID settings that the Minister has announced this morning, are also in addition to the additional and significant resources that have been put into the health system over the last couple of years in particular in response to the pandemic. So it's about providing additional resources and support into our hospitals, providing support for our healthcare workers, and then working with the broader Victorian community about the measures we can all take, either as individuals or in some of those community and workplace settings, to help stop and slow the spread of the virus.
So what would you need is a tougher rule? If it's the leading cause of death now, at what point do you think we'll end up with tougher rules than what we've got?
Well, that's speculating about a hypothetical that we just can't answer today, because if you look at the plans that have been put in place, there were the predictions that we knew that with the opening of international borders, with the greater movement of people following what has been a really challenging couple of years, there was the expectation that this winter would be challenging, with more cold and flu circulating in the community than we've had for the last couple of years. So there was a huge amount, and there has been a huge amount of work in preparing our health system and our broader community for the situation we have faced right now. What has also come along as part of that work that's been undertaken is the introduction of the new variants, and as a result of those new variants and the advice that the Health Minister has received, that's why these announced settings have been made today. It's based on the advice that's been received about having measures in place that we can all support and meet to make sure that there is increased wearing of masks indoors, to make sure that we are looking at ways that we can slow the spread of the virus by the individuals' actions we take, and also working closely in business and industry settings to help those businesses both continue to function and provide particularly important essential services for the community, but also to help measures in the workplace to slow the spread of the virus.
Thanks very much. Under the Act, I'm required to seek advice from the Chief Health Officer. I'm also obligated to consult more broadly with business and community leaders, and indeed with my colleagues. The Chief Health Officer has provided his advice, and I have accepted his advice, except that I have chosen not to extend mandates for mask wearing in some of the settings that were recommended to me by the Chief Health Officer. The advice from the Chief Health Officer was to mandate mask wearing in early childhood and school settings, and indeed in retail and in some hospitality settings for workers in those areas. Now, I have had the opportunity to consult with industry leaders. What our business leaders know and what they experienced last January was that if they don't take actions, they will lose their staff to COVID. So what we saw in January was businesses were closed because their staff were home with COVID. I have assurances from business and community leaders that they will work actively to encourage mask usage, but also the other things that we know can have a real impact. Thank you. So I receive modelling frequently through the health team, and indeed I look at the performance of our health system. These are all factors that inform my decision making.
So what's the modelling? Sorry, what's the modelling show? How many case numbers are we expected to have out this way?
Look, modelling is just that, it's modelling, and it gives us some indication. What I would say is this, and I think Victorians already know this, we now have the new variants, BA4 and BA5, and people will know that people are now getting infected with those variants, and that they need to do all that they can to ensure that we minimise the spread. The most effective way of minimising the spread of COVID is following the advice that is in place through the pandemic orders, listening to the public health messages and putting into place the recommendations that we are making. I want to make this point. This is not just being experienced here in Victoria. Right across our nation, right now, we are seeing an uptick in COVID cases. But we are working together around the nation to face into the challenges that COVID continues to present. And of course, those challenges have been exacerbated by the flu season that we are also experiencing. So these challenges are being experienced right across our nation. But here in Victoria, we have a plan. We have a pandemic repair plan. We're backing it in with $12 billion. We're investing in our healthcare workforce. We're listening to our healthcare workforce, and we are doing all that we can to support them. We are providing advice to the Victorian community so that they can make the decisions that are best for them, best for their loved ones, for our community more broadly, and indeed also for our health workforce.
Epidemiologists have been saying we need to get the message out for weeks. Why has it taken to this point when the wave is on the rise to increase public messaging? Isn't it far too late? And also the strongly recommended line, that's been in the health orders for a long time. It comes out in the show release every day. The ministers haven't been telling people to wear masks, to strongly recommend indoor mask wearing every day. I think it's been kind of ignored. Why has it taken until now to get that message out?
So we have had recommendations in place, and we will be ramping up the communications in order to encourage the uptake. I might also say that the conversations that we've been having with industry, business and community leaders have been ongoing, and I'm delighted that we've got some strong agreement that those leaders will work with us to ensure that we are putting in place or that communities and people are taking the best decisions to do all we can to slow down the spread of the Omicron variants. Once again, I want to take this opportunity to encourage people to take advantage of the decisions that ATAGI have made, which is of course enabling the fourth dose to be accessed by anyone over 30. This is certainly an issue that healthcare workers have spoken directly to me about when I've been out visiting them in their workplaces. So it's really important that, excuse me, it's really important that people take control of their own health and well-being, and that they take the opportunity to get vaccinated. We also know, of course, once again, it's great to now be working with a federal government that wants to cooperate with the states. We now know, of course, that we have antivirals that are available. And once again, our community messaging will be reaching out to people, particularly those over 70, that they can access antivirals now. And we know that the antivirals will have a significant impact on hospitalisation as a consequence of COVID.
Sorry, a strengthened mask mandate's now off the table, given you've rejected the advice now. Can we assume that they're off the table for the rest of the winter?
Victorians know what to do. As Health Minister, and across our government, we will be doing all we can to encourage people to do the right thing. We believe, after 3 years, that Victorians know what to do. They've all experienced COVID. We've all been there before. People not only have experienced what it means to be living with COVID, but they've experienced what it means to be infected with COVID. And they know, and our business leaders know, that it can take out large chunks of our workforce. People want to get on with their lives, and that includes being able to go to work. What that means is that people will be being encouraged to wear masks in indoor settings. And we know right now that we will see infections continue to rise, and that's why I have renewed the pandemic orders. That's why I recommended to the Premier that the pandemic declaration be extended, and why I have renewed the pandemic orders. Now, we know that there are simple and effective things that people can put in place now, simple actions that they can take to drive down that infectivity.
Explain why that immunity period's been slashing from 12 to 4, and is that a national consistent decision, or is that something Victoria's taken a step on?
So that was a decision that we took here in Victoria, but one that I note that New South Wales has taken just today. So what we know is that for those of us who may have had COVID some time ago now, our body's own immunity to the new BA4 and BA5 is not as strong as it was, and therefore we need to send a clear message that that immune period has been reduced.
Some of the modelling, I think we've got 1,200 people in hospital in January. I appreciate there's now a lot fewer people in ICU.
Yeah.
But do you think we're going to end up with another 1,200 in hospital with COVID?
Well, it's challenging, and not really in a place to predict. What will impact the number of people in hospital is the decisions that Victorians make right now.
Have a number, like 1,200?
I'm not in a position to. I would be speculating if I were to suggest a number to you, so I'm not going to do that.
Should we be planning for how many beds may be taken up with COVID patients or flu patients? How many beds will be taken out of the system?
The Victorian Government has a plan. We've got a COVID pandemic repair plan. It's in place and we're implementing it now. Indeed, only last week I was out with the Premier visiting one of our 26, soon to be 28 respiratory clinics. What we are doing is making sure that people understand the other pathways that are available to them. Once again, antivirals will play a really important role in reducing hospitalisation. So we've got more tools in our toolbox now than ever before to reduce hospitalisation. So once again, it's incumbent on all of us, the media obviously included, to make sure that Victorians understand the choices that they have in front of them. And if I could just go over some of those again. Please make sure you keep testing and let us know what your test result is, because that will let us get advice to you. If you're experiencing any respiratory conditions, it might be cold, it might be flu, it could be COVID, it could be asthma. Head to one of our GP respiratory clinics, because they will see you and they will provide you with the care, the advice and so on that you need. And if you're feeling well right now, well, go and visit your GP and say, and ask about the antivirals. Have a COVID plan. Have a plan for what might happen if you get sick. If you're over 70, you can access antivirals. If you are immunosuppressed, you can get antivirals, but they're most effective when they're taken early. So again, there are many strategies that can be put in place right now to drive down hospitalisations as a consequence of COVID. And of course, put on your mask.
Can you reiterate your advice to businesses on work from home?
Yes, so once again, the decision about working from home is one that I believe is best made by employers and their employees. The message to employers is to take the lessons that they learnt from January. It's incumbent upon all employers to do all that they can to keep their workers safe and well. But these are decisions about how they may implement some working from home arrangements. They're decisions that need to be made by employers. And let's not forget that there have been workers who have worked and gone to work every single day during COVID to keep all of us as well as they can, and indeed to keep our society functioning, and to enable people to get on with their lives. But I am very confident, having spoken with industry leaders, that they understand what needs to be done. They will have their COVID plans in place, and that they will be thinking now and talking with their employees about the best decisions that they can make right now to keep their businesses going.
Employees, you guys have some control over as public sector workers. Is there any change to the advice on how many days a week they should go to work? Was there any advice from the Chief Health Officer on that front?
So these are decisions that are made by the public service, and indeed the public service has long held flexible work in place, and indeed I believe that will be continuing.
Can you tell us how many cases are expected and deaths in the coming months?
So any figures that I gave you would be speculation, because those figures depend on the actions that Victorians take right now. We have the opportunity to drive down cases by taking sensible and proportionate actions right now. The simplest of those is to wear a mask in an indoor setting. Victorians have done it before, but it's their decision to make. And I know that the vast majority of Victorians will make those good decisions.
Why can't you say what the modelling will show as far as cases and hospitalisations in the next month, 2 months? Why can't you say that?
Well, once again, I want to make the point that the number of hospitalisations, the people that fall ill with COVID and so on, will depend very much on the actions that people take right now. Never before have we had so many resources available to us to drive down COVID infections in our state. And I want to encourage all Victorians to review their own plan for themselves and their families, to think about their loved ones, the broader community, and of course our healthcare workers. So putting a mask on is a very simple. Putting on a mask is a very simple action that all Victorians can take. I receive advice regularly throughout the course of each and every week on where our COVID caseload is, and also on the actions that can be taken right now to drive that down. Thank you. Once again, I receive advice from the health team, and I take on that advice in terms of formulating the decisions that I've made with the pandemic orders. Thank you. I receive a range of advice, and that does include some modelling and some expectation around, what we might see with various interventions.
I'll jump in on the modelling from Oliver.
Thank you. Yeah.
Yeah, look, can we just take a step back for a minute? to help support and protect our community.
You just listed so many people off work because of COVID and flu in healthcare and every other sector, and you've just knocked back the idea of having more mask rules.
Well, it's about ensuring that there is compliance. It's about making sure that the measures that we have in place are being supported and followed by the Victorian community and are understood.
Your government has consistently said it always follows the health advice throughout this pandemic. I guess what's
The Minister for Health has taken everyone through comprehensively this morning the process and the thinking and the
Is one of the main reasons you haven't accepted fully the advice because there is fatigue in the community?
Look, the Health Minister has gone through this morning a range of different factors that went into her thinking, and part of that was the support of the broader community to help spread the message about the importance of wearing masks. And we already see more and more people wearing masks and understanding the role that they have in helping to stop and slow the spread of the virus. Going out and getting vaccinated is a big part of that, and as is also continuing the work that we're going to do in government, the plan we have in place to support our health system, to support our healthcare workers as we work through the consequences of a difficult winter, a global pandemic, like every other jurisdiction and every other health system in the country is working through.